On January 30th, 2020, the World Health Organization declared the coronavirus pandemic a global emergency. Then 3 years later, that is, in May this year, the Intergovernmental Panel reversed its decision and declared an end to the emergency phase. However, experts have warned that even though the global public emergency phase might be over, the pandemic will be here to stay for quite some time. During the peak of the pandemic, millions of people globally were infected, and some even caught the virus twice or thrice, the results of which are visible to this day. According to research published by the University of Melbourne, of more than 665 million cases worldwide, nearly 1 in every 2 people with COVID-19 is at the risk of developing post-COVID neurological syndrome. It's also worth noting that a link between brain health and coronavirus infections has been known since the outbreak. So in this context, the long-term impact of COVID-19 on the brain may be the expectation rather than the exception. And for those enduring it, its impact is very real. Brain health is particularly at risk, something being felt by those in their 50s and above. The latest research published in Lancet claims to have found evidence that cognitive function and working memory in older people decline more rapidly during the pandemic, regardless of whether or not they were infected. While the world after COVID-19 is unlikely to return to the world that was, many of the problems which we face today will simply be more serious in nature. Analysis from Lancet adds that the rate of cognitive decline quickened in the first year of the pandemic and was higher among those who had already shown signs of mild cognitive decline before the pandemic. The pattern continued into the second year, which researchers said suggests an impact beyond the initial national lockdowns in the year 2020 and 2021. And that raises the most important question. Are people at a potentially higher risk of cognitive decline that can lead to dementia? Is COVID damaging your brain? While the statistics showed the effect that COVID-19 has on the brain health for people at large, in the United Kingdom particularly, the situation post-COVID became so dire that in England and Wales, COVID was no longer a threat because dementia and Alzheimer's disease became the leading cause of deaths last year. The figures published by the Office for National Statistics showed that while more than 22,000 people died due to COVID in 2022, on the contrary, more than 65,000 deaths were reported due to dementia. The pandemic prompted a historic shock to the UK economy. After its outbreak, the United Kingdom was one of the worst affected countries. While more than 7.6 million people lost their jobs in the onset of the pandemic, UK's then Prime Minister Boris Johnson had different concerns. Now, as claimed by Johnson's former top aide, Dominic Cummings, the former Prime Minister asked the UK government's top scientific advisors early in the pandemic if a special hairdryer could be used to kill COVID-19. I'm not making this up. Take a look. Cummings, who quit Johnson's government in late 2020 after falling out with him, used his 115-page witness statement and in-person testimony to assail his former boss's handling of the crisis. While it is now well established that people who have recovered from severe COVID-19 are showing different symptoms: brain fog, poor heart health, sudden fatigue. One thing is clear: we don't know enough about the Wuhan virus to rule it out as an emergency just yet. WION World is now available in your country. Download the app now and get all the news updates on the move.